behalf of the American Liver Foundation's Connecticut Division, it is my pleasure to welcome you to this patient education webinar, Medication Management. As you may know, the American Liver Foundation was established in 1976 by the American Association for the Study of Liver Disease. This cohort of scientists and healthcare professionals was concerned with the rising incidence of liver disease and the lack of awareness among both the general public and the medical community. The American Liver Foundation's mission is to facilitate, advocate, and promote education, support, and research for the prevention, treatment, and cure of liver disease. I welcome you to this educational webinar and invite you to become engaged with the American Liver Foundation. Thank you for joining us this evening. Donna Shaka, the Connecticut Division's Community Outreach and Education Manager, will now take over and introduce our speaker.
Hello, everyone. Michelle Day is a graduate of the University of Phoenix. She has a lengthy history working in the hospital and healthcare industry. Her experience includes medical, surgical, nurse management, patient education, medicine, and patient safety. Michelle worked as a staff RN at Hartford Hospital for 10 years before becoming the clinical leader in GI endoscopy in 1997. She then segued into a career as hepatology nurse coordinator, a position that she held for over 6 years. In January, she became the nurse manager of GI endoscopy at Hartford Hospital. Michelle has been a member of the American Liver Foundation Connecticut Division's Medical Advisory Committee for many years. Before I introduce her, I would just like to go over a little bit about the webinar this evening. This webinar is interactive using the chat option on the right of your screen. So participants are muted during the webinar. If you have questions, please type them into the chat box so that they can be answered after the presentation. This webinar is being recorded and it will be available on our website within the week. And with that, I'm going to introduce Michelle as this evening's speaker about medication management.
Well, thank you, Donna, and good evening to everyone. Thank you so much for joining, taking some time out of your evening and joining us. My goal tonight is to provide you with some tools that will assist you and your family to better manage your medications and to provide some simple tools and resources to help you with your compliance with your medication routine. So let's start with some highlights. First, why is the liver so important? Well, the liver is the second largest organ in your body and is located under your rib cage on the right side. It weighs about 3 pounds, is shaped like a football except that it's flat on one side. The liver is very important. It performs many jobs in your body, including processing what you eat and drink into energy and nutrients so that your body can use them. The liver also removes harmful substances from your body, so it acts as a filter. Now, medication can be used to help you get better and help you feel better. It can be hard to manage, and if misused, it can be potentially dangerous. So making sure that you're taking your prescription, your over-the-counter medication, as well as your vitamins, your supplements, and the alternative therapies properly is important for the health of your liver and for your overall health. So tonight we're going to review why it's so important to know about your medications, how to keep your medications safe, some strategies to improve compliance, in other words, some tips to help you manage your medications, because it certainly can be a full-time job making sure you're keeping up with all the refills, that you are aware of what medications you're on, any medication changes, when you need to have your labs drawn, when you need to go to your appointments. And we'll end up with just reviewing a few resources that I hope will help you manage this portion of your life. I wanted to start with some basic numbers. This slide is from the American Liver Foundation. And there are over 3.5 billion prescriptions written annually. Medications, the morbidity and mortality costs from medications are $200 billion annually. And that actually exceeds the cost of the medications themselves, which is pretty astounding. So again, we're going to focus on some reminders for you. And it's important that you have a full medical history. Every time you go to your physician, they should be looking at your history and reviewing it and updating it at your any of your providers' visit. It's important for you and your family member or whoever you designate to be your healthcare proxy, if you have someone that goes to your appointments with you, that both of you have a full understanding of what your medications are, the name, the dose, the frequency. And remember, this includes not just the prescription medication, but the over-the-counter medications and herbal supplements. And these should be reviewed and verified at each and every visit. It's also important that you report any side effects to your physician immediately. They may be minimal, they may be more severe, and that's really going to help you and your physician partner to see what medications are going to work best for you. So let's start with knowing your medication. I already touched briefly on the importance of making sure you know the name of your medication. And as many of you know, there are usually often two names, right? We know the name that we see on the screen on the commercials, and there's also what we call the generic name. So just make sure that you're looking at both those names because you may get a prescription that has a generic name on it and have a refill with a brand name on it. So you want to make sure that you're careful with that. So know the names of your medications, including the over-counter medications and the supplements. Make sure you know the dosage, and this should be the actual dosage. Not I'm taking 1 tablet in the morning and 2 in the evening, or I'm taking a half a tablet a week. It's I'm taking 12.5 milligrams, I'm taking 2 grams, I'm taking 30 milliliters if it's a liquid. Make sure that you are aware of how much you're taking. Make sure you know the frequency you're taking the medication at. And this should be on a list. All this information here I'm going on this slide should be on a list that you can take with you to make sure that it maintains and you maintain it and that it's updated. Excuse me. Make sure you understand why you're taking it. It's not just because the physician prescribed the medication. I'm taking it because I have high blood pressure. I'm taking it to help me control my fluid because I have ascites. I'm taking it because I have diabetes. You should know how you take it. Do I take it with food? Do I take it with water? Do I take it? Are there certain things I need to avoid? What are the possible side effects? Are there any restrictions while I'm taking this medication? Should I avoid the sun? Should I not be driving? Are there specific things I should be avoiding while I'm on this medication? And make sure you're following the instructions very carefully. Don't skip anything. Don't split them up. Don't double up on the medications. Also be aware that many medications have a protective coating, and this is to ensure that you receive a level dose of the medication and it's what we call extended release. In other words, it's released slowly through your system. And if you split the pill that has this special coating on it, what happens is the medication can be released much faster, and that actually can add to increased risk of side effects. If you notice that you have a loved one that is frequently running out of medication or has leftover medications or is confused about their medications, work with them to manage their medications using all these tips to make sure that you can help them take the correct medications and the correct amounts just to be safe. So let's talk about safety for just a minute. What are side effects? Well, side effects are unwanted or unexpected symptoms or feelings that occur when you have taken medication. And they can be relatively minor, such as a headache or a dry mouth, but they can also be life-threatening, such as severe bleeding or even liver kidney damage. Medications can also affect your driving, so you want to, again, ask about what you can and can't do on this medication. And certainly if you're experiencing side effects, if it's something relatively minor, you may want to just write them down and bring them with you when you go to see your physician. But if they're more severe, you should be calling your provider right away if you have any problems or you're concerned at all about these medications, because he or she may be able to adjust your medications dosage or find another medication that will work better for you. Blood work. Well, blood work and medications often go hand in hand. Blood work is what allows the provider to peek inside your body and see what's happening. It can help us identify your drug level, so the level of medication that's in your system. It can let us see what your electrolytes are and even your liver function test. So all these levels provide additional information for your provider to make sure that you're on the correct dose. And sometimes these lab values can also identify that you're not on the correct dose and we need to adjust them. The one that comes to mind for me is the diuretic medications, the water pills that can affect your electrolytes, your potassium and your sodium levels. So with these, we often monitor your blood to make sure that we're giving you the correct dose. So, and also when we adjust these medications, we may ask you to go back a week later to check. We want to make sure that we're giving you the right dose, not too much, not too little, especially since they impact your electrolytes, your potassium, and your sodium so much. Sometimes you'll be asked to go once a month, and again, sometimes it'll be whenever a week after we adjust the medication. So very important that you get this blood work because it's going to give us a peek inside and make sure that you're able to take, that the medication you are taking is safe for you to take. We're going to discuss the drug-to-drug interactions and the drug-to-food interactions next. So what are drug-to-drug interactions? A drug interaction is where you have two medications, let's say medication A and medication B, which are fine when taken separately. But if you take them at the same time, they don't like each other. So they may be like an oil and a vinegar type of thing. So it's important that when you're on the medication that you do have a list, because if anybody's adding a new medication to your regimen, they'll be able to see your other medications and know if there is truly a drug-to-drug interaction. And now drug-to-drug interactions can cause such things as loss of therapeutic effect. So you're not going to get the right effect off the medication because they're both battling for the same ground. It can also cause toxicity, right? So higher levels, like a poisoning type thing. It can just be too much for your body. It can make a medication work, increase pharmacological activity, so work harder. So if you're taking Med A, you may need to take one tablet, but if you put Med B with Med A, it may make Med A seem like you're taking a double dose. So lots of drug-to-drug interactions, and your pharmacist and your provider, if they have an accurate list of your medications, including your over-the-counter and herbal medications, they'll be able to direct you and they'll know what medications you can take safely together. So what about drug-to-food interactions? I think one of the ones I hear most frequently is grapefruit juice, and that interacts with medications in various ways. One way is by increasing or decreasing the absorption of certain drugs, again, getting that correct level of the medication in your system. So it can cause different blood levels within your system. Some things that affect or interact with grapefruit juice would be antihistamines, blood pressure medications. I think we see that frequently on television. I have high blood pressure, so I can't take these medications. Food is the same, right? Grapefruit juice can interfere with that. Other medications that may interfere with would be thyroid medications, birth control medications, our stomach acid blocking medications, our Nexiums, our Prilosec, those kind of over-the-counter medications. It can alter the way you metabolize those medications. So you want to just be careful. And again, over-the-counter medications are medications. You can talk to your physician or your pharmacist, and they'll let you know which ones you should be avoiding the grapefruit juice with. Diuretics. So diuretics we talked about earlier that can increase or decrease sodium and your potassium. And often when you're on diuretics, we want you to adhere to what we call a 2-gram sodium diet, right? So we want to make sure you're not taking too much sodium in it. So often you think about using a salt substitute. What you need to know about those is salt substitutes actually can increase the potassium in your body because they're often containing potassium. So just be careful when you're using salt substitutes, you know, to read the label to make sure that it's not something high in potassium. Other foods that might be high in potassium, bananas, oranges, and green leafy vegetables. So again, just be aware of what your medications are. And if you talk with your provider, they'll tell you, you know, you're on this diuretic, you want to make sure you are avoiding any high potassium foods or salt substitutes. Now, when it comes to alcohol, they can interact with medications too. We often think of acetaminophen or Tylenol, a medication that's used to relieve moderate pain or lower fever. So if you're drinking more than 3 alcoholic drinks every day, you should be speaking to your physician because you want to be careful on how you're taking acetaminophen or any other pain reliever or fever reducers. So what about storage? Well, if you look up in the upper right-hand corner, you can see a label. And this gives us a lot of information about our prescription, right? It tells us, it gives us our name, it lists the pharmacy, we'll give a phone number. Often now you'll see a prescription number up in the corner, so then when you're calling for refills, you can refer just to the prescription. It's done electronically, often over the phone. You can just punch in the numbers. It tells you how to take your medication. Take 1 capsule by mouth 3 times a day for 10 days. Make sure you complete this. It gives you the name of the medication, the dose of the medication, and it will tell you also, you'll see the use before date. So very important that you're looking at your expiration dates and that you're not taking medications that have expired, because we can't guarantee that you're going to get the correct level of medication in your system if the medication has expired. Now, you may also see what's not on here. You'll often see on the bottle some little yellow tags or orange tags. They'll say, do not drive, may make you drowsy. Make sure you're eating with food. Please refrigerate. All important things to look at the label and read. Now, if you go to your pharmacy with these labels, I know I have to wear my little what we call cheaters, right, to see some of these labels because of the print. They can increase that print. They can even have it written in a different language if that's what you need. So again, work with your pharmacy and they will be able to help you get a label that you can understand. And we've already talked about making sure that you're looking at the storage. Does it need to be refrigerated? Should it not be refrigerated? So most meds are best stored in a dry, even temperature location. So you want to prevent them from breaking down prematurely. So you shouldn't be storing them in the refrigerator unless they're specifically directed to do that. And make sure that once it's expired, you dispose of the medications. And it's important that you also dispose of it properly. So you can call your town or talk to your pharmacist about how you dispose of them. Used to be we would just, dump them down the toilet. It's not always the best now. So we need to call and clarify that. You should be keeping your medications in separate containers. Many of us use pill boxes and they're great. They can certainly help you make sure that you're taking the right medications and that you're not missing any doses. But you have to be careful also that you're looking at when you're putting them in the pill box, that you're taking your time. There's so many medications that have similar names. Many of them look the same. You can even have a medication, as I said before, right? You have a brand name and a generic name. Those 2 medications, it may be the same medication, but they're going to look different. So very important that we're looking at that label. And if you're using pill boxes, that's fine, but you want to fill your pill boxes and keep the rest in the pill container that they give you. And also remember not to put everybody's medications together. So if you have more than one person in the house, which most of us do, taking medications, it's important that I'm not mixing my medications with my son's medications or my husband's medication. And when you're trying to fill a pill box or you're trying to take the medication first thing in the morning, it can be very easy to pick up the wrong medication. So very important. Each of you get your own little space. And certainly making sure that you're keeping it up and out of reach of children and pets. Again, if you go to the pharmacy, they can get you child-proof caps, or if you need something that doesn't have it on there, they can also make sure that they're giving you containers that are easy for you to open. So work with your pharmacist with that. So what are over-the-counter medications? Well, they're medications that you can buy over the counter. You don't need a prescription. Often they previously, many years ago, had to be prescriptions. They've been on the market. They're proven safe. So now the FDA has decided that they can be safely sold without a prescription. But just because you can get them without a prescription does not mean it's safe for you. So again, work with your provider. Make sure before you start any over-the-counter meds or any other meds that you're checking with your provider to make sure that it's safe for you to do so. So examples of over-the-counter medications would be pain and fever medications, cold medicines, allergy medications, the antacids that we talked about before. I think we've all can identify with the photo here in the bottom right-hand corner of our over-the-counter aisles or several of aisles that are in our local stores. Another medication I wanted to review with you was non-steroidal anti-inflammatory drugs, or also called NSAIDs. Now, these medications include things such as Advil, Motrin, Naproxen, and Aleve. And they work because they can increase the risk of bleeding because they block the function of how platelets work. So those who have liver disease, particularly cirrhosis, these can be dangerous for them because when you have liver disease or cirrhosis, your body already doesn't clot always like everybody else's. So there's a little alteration in the way your system works and your blood clots. So this just kind of enhances it. So it can be troubling for liver patients, especially if it can lead to increased risk of esophageal varices or ulcers. So it's just adding additional level. So you want to be careful of that. NSAIDs can also increase the risk of kidney injury because it reduces the blood flow to the kidneys. It can increase water retention. And as I said before, it can increase GI ulcers or stomach ulcers, in part because the way that these medications work, they interfere with chemicals that are in your stomach, protecting the lining of your stomach. So you take this, it breaks down that protective lining and can cause increased risk of stomach ulcers. Acetaminophen, generic Tylenol. This is the most commonly prescribed over-the-counter analgesic or antipyretic medication in the United States. So pain reliever, anti-fever medication. It is also the most common cause of what we call fulminant liver failure. So acetaminophen overdose is also the most common cause of fulminant liver failure. So it is not surprising that many practitioners are very hesitant to recommend this medication to patients with any form of liver disease. It is found in over 600 different prescriptions, and it is an over-the-counter medication. So you can get this without a prescription, and in addition, it's in some prescriptions. And it is safe and effective when taken as directed. And in 2006, the American Liver Foundation actually issued recommendations that the patients not exceed 3 grams a day of acetaminophen for any prolonged period of time. And this was because there was a study that showed AST, which is one of your liver enzymes, could be elevated if even healthy patients took it at 4 grams a day over 14 days. So acetaminophen can be safe for those of you with liver disease and cirrhosis, but you need to talk to your provider because there will be a restriction on what you cannot exceed. So I said earlier that these are in prescription medications, so it's important when you talk to your pharmacist and that they know that you should not be taking acetaminophen. They'll let you know if that's part of the medication that you were prescribed. It can also be in over-the-counter medication, so you need to really look at that. Examples would be pain reliever, fever reducer, cold and flu medications, or sleep aids. See here I have circled NyQuil, cold and flu. You may not realize that it has 325 milligrams of Tylenol in it, acetaminophen. And down below, pain relief PM is a mixture of 2 medications. One of them is acetaminophen. So it's very important that you read those labels to make sure that you're not taking double doses of your acetaminophen. Dietary supplements. So dietary supplements can be beneficial to your health, but supplements can actually involve some health risk. So the FDA does not have the authority to review the dietary supplement products for safety and effectiveness before they're marketed. So it's important that you know this. Dietary supplements can include ingredients as vitamins, mineral, herbs, amino acids, or enzymes. And they're marketed in forms such as tablets, capsules, soft gels, powders, and liquids. These are not over-the-counter medications, and that again is because they are not regulated by a government agency. And because they're not regulated by a government agency, their purity and safety really isn't known. So it's best to speak to your physician before you start taking any dietary supplements. So we just went over the importance of why you need to know what your medications are and your doses and your frequency, and some tips on how to be safe with your medication. So I wanted to move forward and just kind of review about what are some tools to help you make sure you're taking your medication as directed. So I think step 1 is to stay organized, right? Use some tools to help you remind you to take your medications as directed. And there's several that you could use. We talked earlier about you could have a medication card. You could handwrite this. You may be able to, use your computer and keep a list. Whatever you need to do to make sure that you can keep an up-to-date medication card. There are such things as a pill calendar. We talked earlier about a pill box. There's ways you could do electronic reminders. You can get a watch that has alarms. You can use your cell phone. There's several apps, because there's apps for everything, right? There's several apps that you can use to help you remember when to take your medications, or even apps that you can actually enter your medications. Some pharmacies, if you saw the label earlier, it has a barcode, and you can actually scan them into your phone, and it will keep a list of your medications, help you remember when you need refills and that. There's also something called single dose packaging. Now, this is when you're working with your physician, or if you have a nurse that comes into the home, or your pharmacy, they can actually pre-package your medication. So you take one package of medication. It's kind of like a pill box in package form. And sometimes that's very helpful, especially for those who are on several medications and then have difficulty maintaining compliance. Again, if you see that somebody's, one of your loved ones is missing doses, or you are looking at your pill box and you can't remember if you've taken them all, reach out to one of your family members or to your physician and see what kind of support you can get to help you remember when to take them. Sometimes just remember to take them and making them part of your daily routine will help. So do I take them right before my medications and then I brush my teeth? Do I take it before I go for my morning walk? Do I take it at breakfast or lunch around my meal? Again, pill organizers can be helpful, but they're not a complete solution. So make sure that you're using them properly. You have to pay careful attention and have a consistent routine with them. So let's spend a little bit of time talking about the do's. What will help you be successful with your medications? And we just touched on that, right? Staying organized, having a routine. Make sure you're each and every time checking that label before you take the medication. Check with your doctor before you start, stop, or change a medication. And certainly report your problems. Call right away if you have any trouble with prescription or over-the-counter medications, or if you're worried they may be doing more harm than good. There may be something else you can take. Also, especially if you're using a pill box, make sure you have some light on. Don't take the medications in the dark. You may take the wrong one by mistake. I always suggest that you use one pharmacy. I think it's important. We've talked a lot tonight about the importance of working with your pharmacist. If you have your prescriptions filled at one pharmacy, they're going to have all your records and they're going to all be in one place. So that will benefit you because now you can just go to one location, right? And they have a complete list for you. And actually, some pharmacies will print out a list for you that you can carry with you. But this allows the pharmacist also to know that if a new medication is prescribed for you, that there may be an interaction. And that can help, that will alert the pharmacist, and then they can work with your physician and you to make sure that you're being safe with your medication. You should be taking the medication only as directed. I know that medications can be very expensive, and sometimes near the end of the month or the beginning of the month, whenever the cycle is, that you're running low, and so you want to save your medication so you can make sure that you have enough to get to your next refill. Not really a great idea because again, your medications need to stay at a specific level in your bloodstream to be effective. So you should really be taking them as directed, not splitting them or doubling them or skipping them. We've talked about the expiration date and the importance of that a few times, and also drinking alcohol. And that's because some alcohol just doesn't mix with many medications, so it's important to do that. So the don'ts. Don't take after expiration date. I think I've let you know how the importance of that several times. Certainly don't take somebody else's medications, even though you think it may be the same medication. It may even be the same dosage. It's important not to be taking other medications because somebody else's medications. Because what I take for my high blood pressure works for me, it may not work for you. And it actually may be dangerous for you because you may be taking other medications that interact. And just as you shouldn't take somebody else's medications, you shouldn't share your medications for the same reason. Importance of not leaving it where your children or pets can get them. Make sure you're taking only the recommended dose. More is not better when it comes to medications. Also, don't wait until you run out to call and refill. It takes several days. It can take several days to get a refill, and that's because when you call the physician's office to ask for a refill, they're going to make sure that you have seen the physician. It hasn't, a lot of times they like to see you within a year before they re-prescribe things. It may be that, you haven't had blood work for 3 months and this medication is a diuretic that's going to affect your potassium and your sodium. So we need to make sure that you've had adequate blood work, because we certainly don't want you to continue on this medication if your levels are off, because that can be dangerous for you. They're going to look and see make sure that you still need to be on the medication, that they're giving you the right amount. So you really need to give them a few days to make sure that they're being safe on their end to give you the correct medication. And when you travel, don't forget to take your medications with you. Before you travel, you can ask your doctor if, especially if you're going across time zones, you want to talk to them about if you need to adjust your medications when you take them, because you're going to be in a different time zone. Is there something you need to be concerned of? When you travel, you should make sure you have the phone numbers of your doctors and your pharmacists with you. Make sure you have a complete, accurate list with you. If you're flying, your medications should be staying with you. They should not be packed in your checked luggage. They should be carried on with you. And make sure you take enough of it with you just in case something happens. We know that flights get canceled or delayed, and so it's important that you take enough just in case something happens that you may have to stay in one location longer. And make sure that when you're keeping those medications with you, that you're keeping them out of the heat and direct sunlight. So what are some resources? I think we've talked quite a bit about how you should partner with your provider to make sure that you're getting the medications you need. And also your pharmacist. They're both great resources. They can help you answer questions. The pharmacist can partner with your provider to make sure that you're getting your medications as you need them. Pharmacists can certainly answer your questions, especially if you're going to one pharmacy and they have all your medications. When you wander down that over-the-counter aisle, that can certainly be overwhelming. They can help you understand what may interact with you. Some things you might want to let your pharmacist know. If you have trouble swallowing pills, there may be a liquid medication available, because it's not always safe for you to chew or break or crush medications. We talked about that earlier, right? If they have a special coating, you'll be absorbing the wrong level of medication. Go back to the label and make sure that you can read and understand the name of the medications, as well as the directions on the container and those warning stickers I talked about earlier. Don't drive with it, take with food, keep refrigerator. And if you need to, you can get it in a larger type or even a different language. Make sure that you can actually open that container, because those child-proof caps can also be adult-proof. So you want to make sure that you can open the container and ask them if there's any special instructions that you should be aware of on how to store the medication. Also, make sure that your pharmacist and your providers know what you're allergic to, because the pharmacist will look at the medication prescribed and make sure that there's not any of the allergies in there. Remember, we talked earlier about acetaminophen being kind of hidden sometimes in prescriptions. So if you're allergic to something, it can be hidden in another medication. So it's important that you talk to the pharmacist and they know about your allergies. You can have a nurse. There may be a nurse in your physician's office that can help you navigate that. Depending on where you live, if you're living in an assisted living facility, there may be a nurse available for you there, a home health care nurse. So speak with your provider. You can, they may have a nurse in the office or somebody else that with some specialty medications. You can call the company that can help you with those specialty medications. But there's always resources for you. And here's just a few, and these are directed towards medications, and they're both government sites. So, you can see the FDA is one of them. So they can get quite in depth, and complicated, but there are some that you can use that will help you understand your medications even better. So I'm going to look over here and let's see if we have any questions that I can answer. So there is a question about what I believe is crystallose, which is a lactulose, symptoms of ammonia that is causing diarrhea. So let's see, but crystallose causes diarrhea. Is there any way to safely stop the diarrhea through diet? So the medication, the crystallose, causes diarrhea, but that's how your system gets rid of the ammonia. So I would speak to your provider. Often what we say when we talk about that medication is that it has to be what we call titrated. So you may need to adjust your husband's medication level, how much he's taking, because we do want him to have several soft formed bowel movements every day. That's what's going to help keep the ammonia in his brain from his liver disease. That helps excrete it. So it can be quite challenging to find that amount that works right for him, and sometimes that amount actually may change. So that's something that's a great question. I would not suggest looking at a dietary change. I would suggest that you go back to your provider and have a discussion. You know, how do I manage this medication? That's a very common medication for our patients, and it can be very, very challenging. Okay. So hopefully your physician will be able to help you kind of control and find what works for your husband with that, so he can continue to get rid of the ammonia by having good bowel movements, but not go to the extreme of having any diarrhea. I don't see that we have any other questions. So I just wanted to take just a minute to thank you for joining me tonight. I hope this presentation was helpful. I want to thank the American Liver Foundation for allowing me to do this and for their continued support of educational opportunities for our patients, for our caregivers, and for our health providers. And now I'm going to send it back to Donna.
Thank you so much, Michelle. So in closing, we do thank Michelle for her insight on this important topic. I think many of us are on medications and took something helpful from this. In closing, I just want to direct you to some American Liver Foundation resources. We have our website, which you'll see here on the screen. We also have the national website, which is below that. We have a fabulous resource, which is our national helpline, 1-800-GO-LIVER. You can reach one of our helpline specialists if you do have any questions for additional input from them. We have educational materials that you can certainly download if there's anything helpful to you. And there's also drug discount card for uninsured and underinsured patients by going to the Needy Meds microsite. So thank you all for joining us. We hope this has been helpful. And with that, have a wonderful evening. Good night.